Hello, welcome everyone. My name is Aline Yon. I hope you can all see me. Yes. I'm a registered acupuncturist at Yoga Mamas, and today's webinar, it will be on how postpartum TCM acupuncture can benefit recovery and bonding with baby. So first, let's start with gratitude. First, I would like to do a land acknowledgement. I would like to acknowledge that the land we are meeting on is the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Anishinaabe, the Wendat people, and it's now home to many diverse First Nations, Inuit, and Métis peoples. I would like also to acknowledge that Toronto is covered by the Treaty 13 with the Mississaugas of the Credit. I would like also to thank Yoga Mamas for hosting tonight's webinar. And also I would like to thank you for taking the time to educate yourself and to better take care of yourself and your growing family. Disclaimer, this webinar is for educational purposes only. Please, it's not intended to be a substitute for professional medical advice, diagnosis, or treatment. Please always seek the advice of your healthcare provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have learned on this webinar. First, who am I? My name is Aline Yon. I was born and I grew up in France. I'm of Chinese and Cambodian descent, and I now live in Toronto, Canada. I first studied life science, so I hold a bachelor's degree in life science from the University of Paris in France. And then I went on to earn my master's degree in biotechnology management. And after 10 years working in the pharmaceutical industry at a global and senior level, I decided to change careers. And then I went back to school where I earned my diploma in acupuncture and traditional Chinese medicine. I'm now a registered acupuncturist practicing traditional Chinese medicine. Content of this webinar. First, we'll have a quick overview of what is traditional Chinese medicine, because maybe some of you are not familiar with this medicine. And then we'll look at how traditional Chinese medicine and acupuncture can help you in your postpartum journey, and also how is a TCM acupuncture treatment. First, what is traditional Chinese medicine? First, when you look at this image, what do you see? Some people would see a duck. So we would see here the beak of the duck. We would see here the eye of the duck, and then here would be the head of the duck. But other people would see a rabbit. First, we would see here the head of the rabbit. You have the eye of the rabbit, the nose and mouth of the rabbit here, and here we would see the ears of the rabbit. Does that mean that people who saw the duck are wrong? No. Does that mean that the people who saw the rabbit are wrong? No, both are right. It's just a different perspective. We both see the same image, but some of us would see a rabbit, some of us would see the duck. It's the same with traditional Chinese medicine and more modern Western biomedical medicine. We both look at the human being. We both have the same goal, is healing the human being and getting human beings healthy and happy. We just use different perspectives and different techniques. So how would biomedicine and traditional Chinese medicine look at those symptoms? Irritability, depression, no appetite, tiredness, tight shoulders, irregular menses, or PMS. First, biomedicine would say, oh, if you have irritability of depression, maybe it's a nervous system issue, so you might be referred to a psychologist or a psychiatrist. If you have no appetite, they say, oh, it's a digestive issue, so they might send you to a gastroenterologist. If you have tight shoulders, they would say, oh, it's a muscular issue. And if you're too tired, they said, oh, it could be the endocrine system. So they would send you to the endocrinologist. And if you have irregular menses or PMS, they would say, oh, it's an endocrine system issue, or it's a reproductive issue. So they would send you to a gynecologist, for instance. And how would Chinese medicine look at those? They say, oh, all the symptoms, they will go in one same pattern. It's called liver qi stagnation. So in Chinese medicine, contrary to biomedicine, we don't cut and separate any symptoms, we integrate them. Traditional Chinese medicine is more than 2,200 years old. Why we say that? Because there is a very famous book, it's called Anti-Aging. It's the Yellow Emperor's Classic of Medicine, and this book summarizes theory and techniques, and this book was written more than 2,200 years ago. On the contrary, when was modern biomedicine born? It was born in the 19th century with Claude Bernard and Louis Pasteur with what they call biomedicine and microbiology. And contrary to what people might think, traditional Chinese medicine acupuncture works, and there were lots of research done both in China but also in the Western world, and you have lots of clinical trials showing that acupuncture and traditional Chinese medicine works in fertility, pregnancy, also cancer, constipation, chronic pain, depression, insomnia, and so on. So how can traditional Chinese medicine help in your postpartum journey? First, you might know that symbol, the yin and yang. So it's a balance. So in traditional Chinese medicine, we look at balancing the body. And then another concept you might not be as familiar with is the 5 elements. In short, we have 5 elements: water, wood, fire, earth, and metal. And in traditional Chinese medicine, we look at balancing those 5 elements together. I won't go into the theory of the 5 elements. If you have any questions, please type them away and I will answer them later. First, the 5 element cycle of life and pregnancy. So during pregnancy, you have a meridian that is usually used a lot. We would call it the kidney meridian. So kidney meridian is not really the kidney organ in biomedicine, it's more of a function. So I would usually call the kidney meridian the life meridian. And because during pregnancy, you are giving life, you're using a lot of your life meridian, first to keep yourself alive, but also to create life. That's why we would say the kidney meridian is working at least twice as hard when you're pregnant. And the other meridian that would be used a lot during pregnancy would be the earth meridian, which is the spleen meridian. So the spleen meridian in traditional Chinese medicine is different from the spleen organ we see in biomedicine. So the function of the spleen meridian, it's the function of earth, the mother earth. So the function is to nourish. Why? Because you need to build a lot of blood and nourish the little baby that is in your womb when you're pregnant. And just like the kidney meridian, the spleen meridian is also working twice as hard. And what happens when you are working overtime and working twice as hard? Afterwards, you need a lot of rest. But before you can go to rest, there's something called labor. So for labor, there's a lot of energy that is needed to give birth. For instance, this lady during contraction and so on, if some of you have already given birth, you know it's a lot of energy just to give birth. But also if you have a C-section, you would also need a lot of energy to recover from birth, because technically a C-section is a surgery. So whether you give birth vaginally or by a C-section, in both cases, you need to recover first because the delivery in itself needs a lot of energy to recover, but also because during your pregnancy, your life meridian has been working very hard and your nourishing meridian has been working very hard. And again, when you work very hard, you need to rest hard. So after you have given birth, ideally you need to recover. And the first 40 days in traditional Chinese medicine, usually they said 30 days, it's usually 1 month, but some other traditions say 40 days, the first 6 weeks. So I will use the first 6 weeks, the 40 days. So after you work so hard, what do you need to do? You need to rest. So I would really urge you, especially the first 6 weeks after delivery, to rest and sleep as much as you can. Sleep when baby is asleep, and sleep even if the house is messy and dirty. Try to get help for other people to do it, because you only have 3 things to do after you have given birth. First is sleep and rest. Then is feed yourself by eating very nourishing food, easy to digest, warm and cooked. And try to avoid raw and cold food, especially the first week or two right after giving birth. Why? Because after giving birth, your body is really, really tired. So you need to give your body food that would be easy to digest. Why warm and cooked? First, warm food, because whatever you eat and whatever you drink, the body brings all your food and all your drinks at 37 degrees, which is your body temperature. So the body will use up energy to warm up that food at your body temperature before the body starts to digest it and absorb it. So if it's warm, it's more energy. If your food is warm, it's more energy for you to recover. And if it's cooked, because cook technically means pre-digested, it's also more energy for you to recover. And other tips and other food that you would need to add in your diet, especially postpartum, would be bone broth, very important. Red meat if you eat meat, but if not, don't worry. Add have a lot of dark leafy greens and any food of color, like red food and black food, for instance, kidney beans, lentils, etc. Also, add ginger in your cooking, because ginger would help your body to digest. And if you have decided to breastfeed baby, of course, during the first 40 days, feeding baby is the first thing you will have to do. So in short, during the first 40 days, all you have to do is rest, nourish yourself, and nourish baby. Everything else can wait. Get your partner, get family, get friends, or get a doula to do everything else. Cooking, cleaning, etc. And taking care of your other children if you have other children. What else do you need to keep in mind during the first 40 days? First, you make sure that you keep yourself warm, because during pregnancy, maybe some of you notice that you're warmer than usual, but after giving, because it's a young time, but after giving birth, you're more in a yin time. So you would feel colder, and because your body is weaker, because delivery was tiring and pregnancy was tiring, your body has less energy to warm up your body. So make sure you keep yourself warm. Wear socks. Don't walk barefooted on a cold tile. That would help in strengthening your life meridian, which is the kidney meridian. And wear scarves. Make sure that you don't catch a cold, because your body is very weak at that time. Now that we are entering the summer, also make sure to be aware of air conditioning, because the wind from the air conditioning can hit your neck, and that's how you would catch your cold. You really need to protect your neck, your shoulders, and the half lower part of your head to make sure you don't catch a cold. In ancient China, they would say the first month after giving birth, women are not allowed to have a shower. All they were allowed to do was wipe themselves with a wet sponge or wet towel. The reason why it's because back then there wasn't as much hot water as now. So you can still shower, but make sure that the water you're showering with, and also the water you are going to wash your hands, because it's COVID time, so we need to wash our hands a lot, is warm, to make sure that the cold doesn't go into your skin. And after you shower, make sure you dry your hair properly. And also another advice that hopefully won't be too difficult to implement is avoiding screens. Why? Because they said if you stare too much at the screen, if you read too much, you will they say you would damage your liver meridian, and the liver meridian is very, very important for your later health, but also for your emotions. So if possible, try like put your phone away, at least during the first month, if possible, the first 40 days after giving birth. What else do you need to make sure during the first 40 days after giving birth? Please do get help. Get help from your partner, from your family, your friends, even get help from a doula to help you with the cooking, with taking care of the baby, with taking care of your other children, to take care of the cleaning, so you can really focus on sleeping, eating, and feeding baby. If you're more interested in the first 40 days, I would really encourage you to read that book, The First 40 Days, The Essential Art of Nourishing the New Mother. Disclaimer, I don't have any financial interest in that book, but it's a very good book on how to take care of yourself in the first 40 days. And also you can get that book at Yoga Mamas. So why do you need to recover the first 40 days after delivery? First, in traditional Chinese medicine, they said that after giving birth, a woman's body would transform. And as you know, the little caterpillar that has just transformed into a butterfly, it's very fragile at the very beginning. And during that time, you need really to take care of yourself to recover. And by taking care of yourself during the first 40 days, you would get back in a healthier health and in a healthier body. And because you would be healthier, a healthy mama would be able to take care better of a baby. So a healthier mama would lead to a healthy baby. And because you'd be healthier in your body, but also emotionally and mentally, you will have a healthier bonding with baby. And we all know that the early bonding with the baby is really, really important for their future development. Also, taking care of yourself during the first 40 days would also help you to avoid postpartum depression, because that's something that could be a burden to a family when the mother has postpartum depression. And last but not least, in China and Asia in general, the first 40 days postpartum, women really, really take care of themselves. Why? First, to be healthy, to get back to a healthy body as soon as possible, but also because they believe that if you take care of yourself right during the postpartum period, you will have higher chances to age gracefully, and you will be in a better health when you get old. So new mothers who don't really take care of themselves during the first 6 weeks after pregnancy, they might feel okay because they're young and full of energy, but they would feel the consequences later after menopause, for instance. And I put a picture here of the actress Chang Ziyi. Maybe some of you know her because she starred in Crouching Tiger and Hidden Dragon, and also the Geisha. So this picture was taken 2 years ago when she was 40. And you can see how beautiful and how young she looks. And I think it's because, I'm sure actually she did, she really took care of herself postpartum. So we talked earlier about the 5 elements, cycle of life and postpartum. So what's happening? What issues could you encounter after giving birth? So if your spleen meridian, your earth meridian is impaired, you might have lactation issues, either not enough milk or either issues with milk or mastitis and so on. You could also have digestion issues, bloated, very tired after eating. You could have low appetite. Whereas after giving birth, usually, especially the first week, usually it's not a time to go on a diet, especially if you are breastfeeding, because you will shed your pregnancy weight very naturally. And if after giving birth, you are tired, or you have anemia, or if you have pelvic floor issues like incontinence and so on, it would be the spleen meridian, the earth meridian, the nourishing meridian that is weak. And the earth meridian, especially when you're breastfeeding, is also working twice as hard after giving birth, because you need to nourish yourself, but also the baby. And if the spleen meridian is weak, it doesn't produce blood, because in Chinese medicine, we say the spleen meridian is nourishing the body via blood. And when there's not enough blood in the body, what's happening? It's the liver meridian, which is the blood reservoir of the body, is weaker. And what do you find in blood? You find hormones. And what do hormones control? They also control the emotions. So if the liver meridian is not nourished because spleen is very weak, then you would have irritability, vivid dreams, you would be more susceptible to stress. In some cases, you could have migraines, and you would also have pain, especially joint pains. I treated a lot of wrist pain, the mom's wrist, because it's the liver meridian that hasn't been nourished by the spleen meridian. And when the liver meridian, which is in charge of emotions, is not nourished, when there's not enough blood for the whole body, what's happening? The heart meridian, the meridian in charge of your emotions and your joy of life, is impacted. And then you would have emotional issues, you would have insomnia, and you would have postpartum depression. What else could you have after giving birth? When the earth meridian is not nourished, we say earth doesn't generate metal, then you would have respiratory issues or skin issues, for instance, very, very dry skin. And you would also have difficulties to let go of grieving, for instance. And by let go, it could be letting go of your old life without babies, letting go of not being able to do as much as you could. And also, what else could you have postpartum when the life meridian, the kidney meridian, is impacted because there wasn't enough rest during the 40 days after giving birth, or simply because you're tired? Then you would have back, knee pain, you could have night sweats, you could feel too cold or too hot, you would have urinary issues, frequent urination, or getting up at night to urinate. You would have swelling on your limbs, your legs, and so on, and you would also have pelvic floor issues. What can traditional Chinese medicine and acupuncture do when you have all those issues? Well, we can help. For instance, for the spleen meridian, what will we do? We will ensure that you have better lactations, that you would have an appropriate milk supply. If you have mastitis or infection, we could also take care of it. We'll make sure you have a better digestion, no more bloatedness, no more tiredness, and you could be able to eat anything you want. And also, because your digestive system would be working better, then you would have a smoother weight loss, because something that can happen postpartum is a woman cannot lose the pregnancy weight. And when she cannot lose the pregnancy weight, and on the contrary, put on weight after giving birth, it's also a sign that the spleen meridian, the nourishing meridian, is weak. And with traditional Chinese medicine acupuncture, we will also help you get a better energy, and also a healthier pelvic floor. So after giving birth, I would usually advise my patients to go to a pelvic physiotherapist to help strengthen and train the muscles of the pelvic floor. So you would do the exercises with the pelvic physiotherapist so you can work out your pelvic muscles. And traditional Chinese medicine and acupuncture will help you and support you by giving you the energy to work out those muscles. so traditional Chinese medicine acupuncture would help you with the spleen meridian, but will also help you with the liver meridian, because once the spleen meridian can work properly and can make blood to nourish your body, then you will have no more headaches, no more migraines, and you will have a tranquil mind. You won't be so susceptible and overwhelmed by stress, because we have to admit it, a new baby in the house is a lot of change in our lives. So it's quite some stress. And also you would be pain-free, no more pain in the wrist or in the joint, in the shoulders and the neck and so on. And because the liver meridian would be nourished with blood, then no more insomnia, better sleep, better peace of heart. So no more postpartum depression. So you would have your joy back. So you would be able to better bond with baby and celebrate this new life coming into your life. And then because the spleen meridian would be nourished, would say earth can nourish metal, then you would have better breathing. So people who have asthma that worsened after giving birth, traditional Chinese medicine and acupuncture can help with that. You would have better skin, not as dry, no pimples and so on. And it would be easier for you to let go of your past life before the arrival of this new baby and to better embrace your motherhood. And when everybody is nourished, the kidney meridian, the life meridian would be nourished too. And then you will have no pain in the back, no pain in the knees. You won't have any night sweats anymore, so you will have better sleep. Your temperature would be regulated naturally, so you won't be too hot or too cold. Your feet won't be swollen anymore. You will have a healthier pelvic floor. And also very important, because your life meridian, your kidney meridian will be replenished, you will have better potential, better genes for the next baby if you want another baby later. And if you don't want another baby later, that's okay too, because your life meridian would be so strong that your health would be strong for the rest of your life. So in short, postpartum traditional Chinese medicine acupuncture help you recover and better bond with baby. Now, how is a traditional Chinese medicine acupuncture treatment? First, on the contrary to what people might think, traditional Chinese medicine acupuncture is pain-free. Why? Because we use very thin, single-use sterile needles. As you can see here in this picture, taken by one of my colleagues, we can fit more than 10 acupuncture needles in one hypodermic needle. So in short, in the needles that they use to draw your blood, you can fit in more than 10 acupuncture needles. And when the acupuncture needles enters your skin, you might feel a tap and you might feel a dull achy sensation or heavy sensation or tingling or warmth. But the sensation is not painful because after the acupuncture needles is inserted into your skin, you should be able to relax and even fall asleep. So how does a TCM traditional Chinese medicine acupuncture treatment look like? First, I would take your health history, a holistic one. So I will ask you about your physical body, your pains, your digestion, and so on. But I would also ask about your emotions, if you feel sad, if you're happy, if you're angry, and so on. Your lifestyle, what time you go to bed, what time to get up, if you're hungry or not, what do you eat at what time. And I will also look at your tongue. So I will ask you to stick out your tongue, just like this lady here. And also I would take your pulse. And then comes the treatment. Once I know your health history, I would make a diagnosis and then I would treat you with acupuncture, but also moxibustion is burning dried mugwort, gua sha, scrapping, cupping. I would give you lifestyle and diet advice. Some of my colleagues, like Ingrid, is really good at traditional Chinese medicine massage. And also my colleague at Yogama, Mas Teresa, she will also be able to prescribe you Chinese herbs. I haven't said Chinese herbs yet, but it's in the plan in the next few months. So once the needle are in, once you have your moxa, your gua sha, and your cupping, what happens? Well, for 20 minutes at least, you will relax and rest. And a lot of my patients actually fall asleep. And actually, a lot of my patients, when they come for acupuncture treatment, they just get themselves ready for a nap. The only thing missing is a teddy bear. Now, when should you consult for acupuncture, traditional Chinese medicine acupuncture? If you're pregnant, I would advise you to go for labor prep from the 36th week of your pregnancy, because by preparing you to a smooth labor, by ripening the cervix and loosening the muscles on your pelvis so the pelvic bones can open up more easily, you would have smoother birth. And by having a smoother birth, it would be first less painful and hopefully less long for you. It would also ease up the recovery time if you have a smoother birth without complications. And then after you have given birth, ideally the first 4 to 6 weeks, you should stay home and recover and sleep and nourish yourself. So you wouldn't see me, ideally, unless you have an emergency. You have a lot of pain, you have difficulties with lactation and so on, then please do come whenever you have an issue. How often would you come for acupuncture treatments? If it's the first time you see me, it would be ideally twice a week for the first week or 2, and then it would be once a week. And for how long? Usually I would see you until your issue is resolved, whatever issue it is: pain, lactation, digestion, insomnia, anxiety, and so on. Usually 4 to 6 sessions weekly would be enough. And then afterwards, ideally you would have a follow-up every month. Because again, traditional Chinese medicine, their goal is not to make sure how can I say, biomedicine, for them, you are in good health if you're not sick. In traditional Chinese medicine, in good health means you're full of energy and happy. So if you have any event in your life that stress you out or prevent you from being happy and have a good sleep, please come for a follow-up. Now, a few bonuses to keep you healthy and happy. So if you are cleared by your doctor and your pelvic physio and any other healthcare professionals, usually after 6 weeks after delivery, and if you're ready to go back into gentle exercise, know that Yoga Mamas has an on-demand yoga, but also fitness and meditation classes. You have the link here at Yoga Mamas On Demand TV. So you can benefit from 1 month's free classes with this promo code FTBALI2, and this promo code is valid until the end of July of this year. So feel free to take a picture of this coupon and use it whenever you're ready to meditation and yoga classes or fitness classes. And if, again, once you're cleared by your healthcare professional that you could do some gentle exercises, I would invite you to do the Meridian Gym. It's a gym that is based on the traditional Chinese medicine Meridian, and that would help you keep stress at bay and optimize your health. So you would do it either in the morning or whenever you're stressed out or you're tired and you need energy. You should not do it before going to sleep, because again, this Meridian Gym gives you energy, and not after food, because after food, the energy should be used for digesting and not to move all over your body. And please don't do it if you're pregnant, because at this point, I don't know the effect of the Meridian Gym for pregnant patients. So you can find the Meridian Gym here on this link at Yoga Mamas On Demand TV. And this Meridian Gym is free access. So by all means, use that Meridian Gym for yourself, but also your partner and your family. It's really a great gym to keep you healthy. Thank you for attending this webinar. So my name is Aline Yon. I'm a registered acupuncturist practicing traditional Chinese medicine at Yoga Mamas. So I practice on Tuesday and Saturday. You can join me at this email, alinyon@yogamamas.co. And here you have also Yoga Mama's website. If you want more information or if you want to make an appointment, either with me or either with my colleagues, Teresa or Ingrid, because we work as a team. And here you have the phone number. So if you have any questions, please let me know. I am going to go on the chat now. Okay, it seems that you don't have any questions, at least for now. So, okay, so it seems that you don't have any questions, at least for now. If you have questions later, please feel free to email me at alinyon@yogamamas.co. And do take care and be happy and healthy. Have a nice evening. Bye.